we'll go ahead and call this meeting to order. This is the Assembly's Health Policy Committee meeting. Go ahead and do a roll call. That sounds good. Austin, Quinn Davidson.
Felix Rivera.
Forrest Dunbar.
Christopher Constance on the phone, and Suzanne LaFrance is here as well. And then, did you all want to introduce yourselves?
Carissa Slippy, Clerk's Office.
Dean Gates, Assembly Council.
Jen Thulin with Counter Drug and Anchorage Health Department.
Natasha Pineda, Anchorage Health Department.
Great, and we have some others in the audience. If people end up speaking, we'll just have them introduce themselves. And Mr. Perez Verdiaz just joined us as well. Okay, we're going to go ahead and hear an update from Ms. Pineda from the Health Department.
We're just having a little technical difficulty, but I think...
Do you want to do it at the end?
I think we can get it going. So we passed out a set of slides, so I can at least do the introduction and talk through this. Instead of doing my regular director's update, we were just going to slide in a 15-minute update on meth, really related to the substance misuse assessment, kind of a mid-year reminder of kind of the continual issues that we're having in the community. And so Jen Thulin has been partnering with us. I think you guys have met her before, or she's come to some of the meetings. This is her area of expertise, and she put this together, and we wanted to give her an opportunity to share it with all of you. So I don't know if you just want to walk through the slides until we get them up. Carissa, is it entirely possible that it will work or not?
Yes,
really?
I just need the passwords. I'm working on it.
Okay.
It needs to be three uppercase, three lowercase.
Okay.
Would you like me to just do it? Or?
Yeah, you can start walking through it. So essentially this is going to be a combination of state and local information and an update.
So, do you have any extra copies for people in the audience?
I handed out everybody.
Okay. So everyone has copies?
Not everyone.
Most people? Okay. I'll just go ahead and go. So hello everyone.
If it's something that's going to be fixed, we could do it afterward.
I would prefer the image be up just
For the slides to be up?
Yes.
Yeah, should we just go ahead and change the order? And we could do number 4, if there's any comments on that, and give them a few minutes to get their work done. Okay. So we've added, at the request of the chair, we've added this to each of our assembly committee meetings, whichever chair, I don't know, to discuss our legislative priorities and also budget items for 2021. I don't think we have anything set. This is the first. Okay, great. Ms. Altel?
Yeah, so for legislative priorities with respect to API, next week, I believe it's next week, the 10th, the legislature will be taking up things related to API. So I'll be providing, as a personal individual, some testimony, but if you want to put that on your radar, there's a bill by Representative Sponholz concerning the governance of the API to move it to an independent board.
Great, thank you. Mr. Rivera?
Yeah, thank you, Madam Chair. I would just want to speak briefly to this. This was one of the last things that I did as chair. And in essence, what this is a placeholder so that it helps staff keep track of any legislative or budget items that come up. Because what I didn't want to happen is we talk about something and then we forget about it. And the next year we talk about it again, we forget about it, and it just becomes this cycle. So this is a way for staff to really ingrain this conversation and keep track of anything that does come up.
Okay. Thanks, that's a great idea. Anybody else have any thoughts about our legislative priorities as they relate to health policy? And anything about budget items for 2021? Okay, well, we'll be keeping those on there. There'll be standing things to discuss, so just keep it in mind for next time. And it looks like the slides are up, so we could go back to number 3, new business, 3A, the AHD update, specifically focusing on that.
Okay. All right. So hello everyone, and thanks so much for having us. My name is Jen Thulin, and I work for the National Guard Counter Drug Support Program. In this role, I provide support to the Anchorage Health Department's substance misuse prevention efforts as they relate to the national drug prevention strategies. I also facilitate some data sharing between the state of Alaska, the counter drug law enforcement partners and with the health department to help us get a comprehensive understanding of drug trends across the state. I would like to disclose that I am not an epidemiologist, although I do have resources if you have these questions in relation to epidemiology, or a medical examiner. Much of the state level data I will share today was informed by an epidemiologist. Most of my experience has been in the treatment of opioid use disorder, so when we get to these questions, I'll answer to the best of my knowledge. Okay, for this data review, we'll be taking a tour. We will first look to our left at the city's meth overdose data, given what we know from the health department's assessment and the fire department's data. Then to our right at the state as a whole, presenting some of the newest and unpublished data from the state of Alaska. Then we will take a quick pit stop and look at the national meth-related mortality data. This will bring us to a summary of what the data is telling us about Anchorage's polysubstance landscape as it relates to public safety and public health. And the last part of this presentation covers ideas generated to address the community-wide problem. So let's start with the Anchorage community level assessment. Because we know that these deaths are increasing nationally and in the state, AHD wanted to investigate this further to see what the local impact is. People were saying that it's a rural problem, and what we found out is that it's not. Although it is high in rural communities, as we can see here, when Anchorage overdose death counts are isolated, and this is a count, not a rate, I just want to point that out, you can see from this graph that during 2013 and 2018, we saw a 233.3% increase in the number of meth-related overdose deaths. The AHD assessment also heard from community members and providers that the combination of opioids and stimulants are common. And we know that these combinations are dangerous and increase an individual's risk of overdose. Some providers were predicting this spike in overdose deaths and complications. So aside from this 233% increase in meth-related deaths, this graph points out the alarming rate of psychostimulant mortalities. And I just want to clarify that when I say psychostimulants, I mean 3 different substances: methamphetamines, Adderall, and Ritalin. Lastly, I think it's important to review the methamphetamine problem from an EMS perspective. So the recently published report that they shared with the Anchorage Health Department, and it is publicly available, their report mentions the prevalence of methamphetamine and opioids being used in combination, much like what we heard from the public in the AHD's assessment and what we see playing out in the overdose data. The two substances are being combined and making for an elevated risk for overdose and other harms.
And so can I ask Ms. Dalto to answer the question?
Hi, thank you. Do you know if this data with regard to the EMS transports, are the numbers duplicated in any way? So did AFD report, so in January, 42 meth-related transports, 11 opioid, and 2 heroin, were those like isolated, or if there were polysubstance?
They're not. From what I understand, they're not mutually exclusive. So all of this is smelling like polysubstance, if that makes sense.
Okay.
It's not isolated.
Not isolated. So we shouldn't add 42 plus 11 plus 2, let's say in January, to come up with a total number of transports in this area because they may be duplicative.
Those are individuals, and I think Jody Hedrick would be, like, the
I
fire
can
department would
ask
be
it.
better to answer that question.
Okay.
We just asked if we could share those numbers. I didn't
Okay.
ask her if the 2, like
They
in
separate
January, if the 2 that were heroin were also in the meth file. I suspect they're separate or different, but
Okay.
we'll let them respond to that.
Okay, thank you.
And this is also from a 12-month report from AFD EMS. And if you focus on the black line, it shows you that increase from September to December, October to December, and methamphetamine-related responses. Okay, so now switching to the state of Alaska's 2019 psychostimulant report. So 3 highlights that I took out of there from this new unpublished 2019 Havers report reveals that during 2014 through 2018, nearly 40% of meth overdose deaths involved heroin, mirroring what the national data trends have been telling us about the nation as a whole. Also, the Anchorage region, as it probably comes to no surprise to anyone here, experiences the highest overdose death rate due to methamphetamines. Another interesting finding is that the age group with the highest overdose death rate was 45 to 54. And if we look at the proportion of all drug overdose deaths attributable to meth or opioids, the proportion of deaths involving meth, seen here in the yellow, continues to increase, while the proportion involving opioids has remained relatively stable across recent years.
And just to clarify, this is all from an unpublished state report that once it's available, we'll share with them with you.
And Mr. Presser, do you have a question?
Yeah, I guess I just wanted you to address the whenever I look at statistics like this, as alarming as they are, I always remember the population size that we have. And one of the challenges that we face with when we use percentages and compare it to others. Can you speak to that a bit? I mean, for instance, when you see a dramatic increase in the number, but it's in the teens. So it's not hundreds or thousands, it's 14. So
are you looking at a count on a certain page?
Right, so on page 5, the AFD substances of abuse report, the scale on the left is 0 to 50. And so and then the next page, on page 6, Alaska specific data, percentage of methamphetamine and percentage of opioid of all deaths in Alaska. So all deaths.
I'm guessing
we don't know what slide you're on.
where
I'm
you
sorry.
are.
I guess I'm more asking for a larger sort of reaction to the challenge associated with the small numbers that we have in terms of the when we're comparing it to other states like West Virginia and other places that has a significantly larger population than we do, how do we justify the comparison?
We adjust for rate.
Okay.
So in public health, we adjust for rate as opposed to focusing on the count.
But
The point I'm trying to make is that whether we're talking about our crime or we're talking about health issues, I guess the continuing challenge I have is that we have a very, very small population. And so when we see large increases in percentages, it can feel like a disaster or this huge thing, but you look at the actual number and it's only 10 or 20 or 30. Not that that's, still that's a lot, right? I guess I just wanted you to speak to that a bit. I have a difficult time with that sort of challenge.
So there's a formula they use in public health in order to adjust for those differences between states, and that's why we really like to use rate instead of count, because people really get lost in that.
So today we're providing you with lots of different little pieces of information just to keep you aware that, as we discussed last May, and as FIRE predicted, methamphetamine is on the rise. Death related to those are on the rise. And although West Virginia may have a higher population, and I mean Justin could probably speak to this as well, or Chief Dahl can speak to this as well, is that they care for that in how they generate their rates. So whether it's syphilis or STIs or suicide rates, which are incredibly high in Anchorage compared to the country or the state, they care for that. So the thing is that it may be a small number, it may be only an increase of 5 or 10, but because our population is so small, that is significant, and that the increase in deaths of despair is significant, and that we need to be thinking about it. So this is mostly just an opportunity for you to look at different pieces of information and be aware that a state report is going to be coming out that's going to indicate that Anchorage is an area that has an increasing and higher rate than the rest of the state related to methamphetamine deaths, and for us to just be cognizant of it. But I appreciate your question. I almost brought my epi stat book to answer questions about what is the rate exactly, and then I thought, I'm not an epidemiologist, but we can have one. I took a class once, but we can, in a future meeting when we have more time, we can bring someone that can answer those specific kinds of questions to a satisfactory level.
Yeah, and I was just, the last thing, and then I'll shut up, is that I'm cautious of these statements, like nearly a third of overdose deaths in 2017 involved cocaine. But if there were 3 of them, then that sounds like huge. That sounds like this massive thing, but how many of them were there? And so that's the thing I'm always just sort of a little bit hesitant about when I see these things, especially in our state. So
Sure.
just,
Thank you.
yeah.
Yeah, and just echo that. I think he makes a good point, right? To say there's a 50% increase, but if it's from 2 to 3 versus 200 to 300, that's significantly a different landscape that we're dealing with. Mr. Constance in the queue?
Yeah, thank you. I just would like to be a slight counterpoint to that argument that you're not arguing it's not significant, so I'll be careful, try to be careful with my words, but the challenge we face in terms of how policy is set, how funding is distributed from a national level, how we are able to respond when critical incidents do start to occur, is that if we only, or if we're more focused on these small numbers, we miss the trend, and when the trend hits and it exceeds our means, then we have a real problem. And I have seen this in my work trying to provide resources for people with HIV who are addicted. And you cannot get federal funding for that here because our incidence rates are so low. The money they would spend here would serve, serving 50 people would serve thousands in LA. But if we don't deal with these outbreaks of HIV, people using needles, and these things that happen, it's like wildfire. And all of a sudden you can have 30 and 60 people who are sick, all because we weren't a priority for the larger systems. And so I think the wisdom in us looking closely at these numbers when they're small is our mission, our purpose should be to keep them small.
Thank you, Mr. Constant. Ms. Salatel?
Yes, thank you. Do we know what the total number of overdose deaths were in any of the years on page 6, the slide before this, just maybe for a little bit of context? A bit of a ballpark.
For the state of Alaska?
Yeah.
I do have that data. It's on a different slide that I removed, but I can provide you that later.
Yeah, I think that would help, just if we're talking thousands or we're talking hundreds, so that way I can kind of wrap my head around it. And also, do we know the kind of or is there a place to find the top causes of death in Alaska, kind of and where does this kind of fall?
Yeah, and a lot of that is in the assessment that we did in May. This is intended to just be an update on this one topic, but we can send
In
to
that
the
booklet?
update. Yeah,
It's in the book.
Okay.
we'll send you some more information.
Okay,
We're moving over to the CDC now.
thanks. Okay, great.
Okay, so we're going to go a little bit wider here.
This is
So-
federal.
Yep. So now shifting over to federal. It is of growing concern nationally that opioids are an issue, but an emerging trend here in Alaska is the overlap between opioids and methamphetamines, as the CDC recently published data indicating that Alaska is now seeing the highest methamphetamine-related death rates in the U.S., second to West Virginia. Nearly a third of overdose deaths in 2017 involved cocaine, stimulants, or both. And then also, I just wanted to clarify, psychostimulants, including Ritalin and Adderall. In the U.S., half of psychostimulant-involved deaths also involved opioids. And although addiction is sometimes viewed as an individual-level problem, Evidence tells us that an intersect between methamphetamines and public health exists. Listed here are just a few of the challenges associated with methamphetamine in our community, and I'll just read them off. Methamphetamine misuse brings a greater risk of HIV transmission than heroin injection. Methamphetamine misuse found to be significantly predictive of self-reported violent criminal behavior and general recidivism. And methamphetamine misuse is normally associated with higher rates of property crimes. So these are just a few of the evidence-based practices or activities at the health department. There's a lot more, but these are just a few. These strategies are aimed at preventing people from becoming addicted in the first place, reducing harm for people who are already addicted, and improving access to treatment, and then training employees who work directly with high-risk individuals with appropriate responses. So there's medication disposal bags, which you might have noticed when you walked into City Hall. The Anchorage Health Department is also a overdose response program through the state of Alaska's Project HOPE. And in 2020, they're hoping to be the third health department in the U.S. to install a naloxone box unit co-located with their AED. All right, so we'll talk a little bit about recommendations before we end. Aside from the efforts made by the health department, community citizens might ask, what is the next step for reducing the burden of substance misuse in the city as it relates to polysubstance misuse and overdose? Here you'll see a few of the recommended interventions by the CDC. We could improve awareness, including radio spots, online ads, social media, signs and videos, improve public health, public safety collaborations, link people to medication-assisted treatment and risk reduction services, continue our opioid overdose surveillance, continue opioid prevention measures, including expanding naloxone availability. And I'd like to end, before we get to questions, with a quote from the CDC. Public health and public safety can help equip first responders and community partners with naloxone to prevent deaths from overdoses in these areas and link people with treatment and recovery services.
Thank you. Would you mind going back to the prior slide on recommendations? Sure. Just wondering if Ms. Pineda could speak to what of those things we're doing and what, if we aren't doing, what resources we need to be able to do it.
Well, right now, one thing we've continued to do is we did continue to we work with Sarah Richardson still to manage updates on the opioid surveillance side, so we'll be able to do an update in May, like a one-year update to the substance misuse assessment. Chief Bell and I collaborate all the time, right?
Sure.
Yeah, I mean, I think we're continuing to do that. We have an effort inside of our community health nursing to develop an appropriate screening, brief intervention, and referral to treatment for public health clinic. We will most likely partner with the neighborhood health center. So we don't have, we have our public health nursing grant, which does have a focus area of 7 that is on substance misuse. So we'll be continuing to do little increments. It's not a main portion of what we do at the department, but because of the partnership with the state and the National Guard and the fellow from that previous year, we were able to implement a few things, and we're just trying to seed some stuff that we can do without kind of toppling our infrastructure. But that just includes continued engagement with our partners and with fire and police and state partners around the issues. We have staff that are deployed to some of the substance misuse coalitions and just continuing to develop partnerships.
And do you feel like what you're doing now is enough, or do you need to do more but you can't?
Yeah, I think we typically there's a lot more that we can do. We're simply not resourced to do it, but it's a personal interest of mine, so that's what I bring, that's what I brought with me, along with general public health interests. But it's all interconnected. The trust recently issued a costs of drug abuse in the state, and I don't think it focuses on the costs to just Anchorage, but the costs are high. So fire, police, ourselves, all of the services we're dealing with can be directly related to a large portion of those costs associated with unmet needs related to treatment, substance misuse, and other issues that are, I think, affecting our population. Even though the number might be small, the rate as it is associated to other states is significant, and we shouldn't ignore that. There was an initiative, I think specifically on meth a few years ago, and maybe it was like 10 years ago, there was somebody in the mayor's office that just worked on meth, and it's just an issue-specific period of time, and that's kind of how things go around substance misuse. As federal funding comes out, and we all get money and we focus on it, but if we were creating a structure or a system that would have strong foundations, we would be looking at general prevention and ensuring that those things exist in our city. But we don't at this time, and we'll just continue to develop what we think would be good things to do going forward based on our reality and resources.
Great, and I just ask that, as we start thinking about next year's budget, it's just great to have, these are the things we really need, and for us to know how we can help support that when possible. Mr. Dunbar has a question.
Thank you, Madam Chair. I'm wondering if there's another way to interpret some of this data, and that is, when did we start really rolling out naloxone, which you mentioned up there, Narcan? When did that really start getting distributed
In
more
Anchorage,
widely?
there's actually
in
a
Anchorage?
slide not here, but it's in the substance misuse assessment where you can see it directly in the overdose death data.
So I'm wondering, so if you
I
look
think
at...
it's 18 or 17.
Okay. You think it's that late? It's not earlier than that naloxone started to become more common?
I don't think the emergency didn't really start getting, I'd rather email you. I think it was 17 or 18.
I'm curious what percentage of this, if any, is driven by the fact that we are now saving people's lives that would have OD'd on opioids. You can see it kind of in even 2017, 2018, that the opioid percentages are going down and the methamphetamine percentages are going up. And just knowing, just having some people in my family that work in emergency rooms, you have the same folks that are coming in ODing over and over on different things. And I wonder, we're saving their lives from opioids, but I don't believe we don't have an equivalent kind of miracle drug for methamphetamine. So would some of these folks have perished in the last few years of opioids, but now they are instead being killed by methamphetamine, if that makes sense?
It's possible, and I don't know, Chief Dahl speak about this. Methamphetamines has been a problem for a long time. Meth is more mixed with opioids now than it was in the past, so a lot of it's combination.
Yeah.
I don't think, I think there's definitely I've been working in substance misuse prevention for like 25 years, and one thing goes down, the other thing comes up. It's
right.
Demand, and so we cut off demand we don't allow opioids, or we're making it less available. Something else is going to pop up in its place.
Right.
I can't speak to whether or not those exact people, we saved you with naloxone and now you've become a meth addict, or you were always a meth addict and you almost died
Well,
from
I guess
opioid
I think it gets to my sort of broader point, which is I think we in the public policy world tend to focus on substances,
Yeah.
which is really the wrong approach, right? I think that's kind of what you're getting at.
Right,
too.
we need to make sure that there's adequate treatment available and preventative services and
Right.
family services so that people don't become, we're not even debating whether or not
Right.
they're using meth or opioids, but we have a healthy community.
Right. Policymakers tend to swing. It's like, oh, we're panicked about crack,
Right.
and then we're panicked about meth, and then we're panicked about opioids. But it's not exactly the same folks, but it's typically folks that are self-medicating, they're finding a substance. There's always going to be some substance that is killing folks, and they might be killed by meth, or they might be killed by opioids. But
Or alcohol in the
Or
state.
alcohol, yeah, exactly.
There's lots of different ways to.
Yeah, I guess I just want to make sure that we're not, sort of, playing whack-a-mole, where it's like
Yeah.
we're all focused on opioids, now we're going to be focused on meth, but we really know that that's not the issue, it's not the substance. Even if we could get all opioids and meth off the street, there would be something else. There's always something else, right? It's about treating the people and the underlying hurt rather than the substance.
Yeah.
Okay.
I agree.
Mr. Constance, a question?
Yeah, such an interesting conversation. Yesterday I met with the regional management for Cars Albertsons, who flew up from Seattle to talk about issues here in the neighborhood. And the person who's in charge of their regional security had a very chilling warning for me. And his warning was that if our experience parallels theirs, which in a number of ways I would assume and believe it does, that what we are seeing right now is the foreshadowing to a massive meth boom that is coming in the next 2 to 6 years, related to the fact that we are coming up with treatments and interventions for opioids, and that the supply down south coming across the border is really, really flowing at this time for cheap meth. And so while I think Mr. Dunbar's point is apt about make sure we're focusing on the people and meeting their needs, we in fact may find ourselves landing where Seattle has been in the last year, which is the major criminality and crises that are happening on their streets are being driven by people who are literally psychopathic on methamphetamine. They're out of their body, they're out of their mind, they're high energy and out of control. And so I heed this warning very loudly, especially in context of what I heard yesterday from someone who lives in a place where the world has assumed Seattle is dying.
Okay, if there are no other questions, I think we should move on to the next topic.
Thank you, guys.
Thank you so much for that presentation. Okay, we're going to move on to 3B to discuss Tobacco 21 and its implementation and related enforcement. And Ms. LaFrance is going to go ahead and just say a few comments to open it up. And if Chief Dahl and maybe Emily Neiman and Mr. Hess, the Ombudsman, want to come up here, I think you'll all be involved in the conversation. So that'd be great.
Can I ask Shanice from the Lung Association, who's working with schools, school programs, to join us as well?
And then if you all could just, I know I sort of introduced you, but introduce yourselves and your organization, that would be great.
I'm Emily Neenan, Alaska Government Relations Director, American Cancer Society Cancer Action Network.
Shanice Roach, American Lung Association, Health Promotion Specialist.
Daryl Hess, Municipal Ombudsman.
Justin Dahl, ABD.
Great, thank you so much. Ms. LaFrance. Thank you, Madam Chair. Do we have anyone specifically from the school district here to join us? Okay.
All right, well, thank you all for being here and for participating in this conversation. Just a little bit of background to refresh everyone's memory about how we ended up here at this point. The AHD 2019 Community Assessment findings recommended implementing Tobacco 21 as a policy, which the Assembly unanimously approved AO 2019-90S, which increased the minimum legal age to purchase tobacco products to 21, and also removed the penalty for use and possession by someone under 21. And what happened after the ordinance went into effect, it was timed to go into effect right as school started on August 20th. We approved it on July 23rd, 2019, and it went into effect shortly after. And I think it was in December, it came to light that there were minors being cited under state law and by APD officers. And there's an article in the Daily News, I think on December 1st, and actually the data is available, the APD minor citations and the breakdown by school, as well as the school board policies concerning tobacco and vaping, alcohol, and a drug-free campus, and the superintendent's letter in support of Tobacco 21. So this started a big conversation concerning the relationship between local code and state law and discretion of APD, and what would need to happen to enact the Assembly's intent of not enforcing minor in possession. So that led us to some conversations with the school district, which Mr. Hess, you've been really involved with, and will give us some background on that. And Emily, or Ms. Neenan, you've kept us in the loop about the changing landscape and efforts to implement Tobacco 21 at the state level, but now we have a big federal change, and that's also in play nationwide. And so the question of where do we go from here? How do we develop a coordinated, consistent enforcement policy, right? And what do we need to do? Do we need to do anything at the local level? Do we need to do a resolution to the state in support of Tobacco 21? Do we need to add minor in possession back into the local code with an emphasis on education and treatment, right? So those are some of the questions that drive this conversation. Actually, if we could start with Chief Dahl, the question of, why can't APD just enforce local code, was a big driving force in the conversation. If maybe you could speak to that piece and how state code fits in, and perhaps too, with the role of the school resource officers in your department and how that plays into some of these numbers.
And could I just say something before you go, Justin? So Mr. Weddleton's not here, but he was also a co-sponsor of this. And the three of us, I think in work sessions as well, had a lot of conversations about what the goals of the ordinance were. And when Mr. Trainey originally proposed it, we got, I think, 3 pieces of feedback. One of them being from experts, minors should not be punished. The idea here is to get vendors to stop selling to minors, and vendors should be the ones that see penalty. And so we designed a penalty structure that way, and it's my recollection that we discussed that with our colleagues, and that we discussed that with the public, and that we discussed that a lot. So we were very surprised to learn that APD was issuing tickets to minors, but we want to understand why and what we can do about it and what we can fix if we need to. So, thank you, Mr. Dahl. Chief
Thanks.
Dahl.
No, it's okay. So I think it was interesting to be part of this discussion sort of beginning in December, and when I hear Ms. Quinn Davidson say that there was surprise that APD was issuing citations, I think there was surprise on the part of APD that law had changed, and we hadn't been included in that discussion, or at least even really advised of it until questions started being asked about why are these citations being issued. So I'm just thankful that we're able to be part of the ongoing discussion about it, because I think, law enforcement's perspective is always from a law enforcement perspective, right? An enforcement perspective, how things sort of function on the street, and not necessarily the policy perspective, but I think we can provide advice from the enforcement side that can help create constructive, useful, successful policy. So with that in mind, Ms. LaFrance asked about how discretion works and the enforcement of state and local codes. So in Alaska, the way law enforcement officers are sort of created is under state code, they're authorized to be law enforcement officers. And then as a municipal law enforcement officer, you're further authorized to enforce municipal code. So we have sort of the authorization to do both. In some states, it's a little different, where if I were a city police officer, maybe I could only enforce city code. And once I left the city, I really had no enforcement authority, where in Alaska, the opposite is true. And I could, as a sworn law enforcement officer in Alaska, I could literally be in any part of the state and say, for example, enforce fish and game violations if I wanted to. That my legal authority allows me to do that. Probably my boss would wonder why I was in Ketchikan enforcing fishing violation, but it's legally possible. So with that in mind, sort of that oath that law enforcement takes in Alaska to enforce the law is at the local and state level. So with regards to why an officer would choose one section of code or another, it really is an individual discretionary choice on the part of the officer. And it's typically when they're confronted with a problem. law enforcement officers get hired to be problem solvers. And so if, for example, with school resource officers who mostly live in the schools and work with the school district to resolve issues in the schools, if they're approached by an administrator, it's like, hey, we have this problem with somebody using tobacco on school campus, can you please help us address that? They're going to approach that with, okay, what tools do I have in my toolbox to try to change that behavior? Because it's being presented as undesirable behavior at a school campus, and if there's one particular piece of code that appears to be more appropriate in addressing that issue than another, that's typically the way that they go. I'll point out that 82 citations, which was what was reported, I think, through October, I think is what this says, and that sounds right. Maybe that sounds like a lot, maybe it doesn't, but just for reference, and this, I think, something that goes back to the previous discussion about numbers, that's out of about 36,000 citations that APD had written at that point, so we're talking about a very, very tiny fraction. The reason I bring that up is this was not like a concerted effort by APD to enforce anything in particular. It's just as a result of, and this part's sort of anecdotal, but we feel like it's a result of an increase in the number of vaping incidents that the school district was observing on campus, and then reporting to school resource officers who were then responding to that and trying to apply whatever tools they had available to change that behavior. So I just wanted to make it clear that there wasn't like some campaign by APD to enforce tobacco code all of a sudden. In fact, it's a very tiny, tiny, tiny fraction of what we were doing overall last year. So I think that I answered all the questions, but if I missed something, please correct me and I'll circle back to it or answer any new questions.
And Ms. Altel's on the queue, but I just wanted to say quickly, as soon as we realized this was going on, we've all worked really collaboratively to fix it. So we're all on the same team.
Totally agree.
It's just sort of trying to figure out what happened before that.
I completely agree, and I am happy to give suggestions from that enforcement perspective on what might not be
going
useful.
forward.
Yep.
Awesome. Ms. Altel?
Thank you. Chief, is it reasonable to say that these citations are likely all issued by school resource officers?
Yes, in fact, I think when we looked, I couldn't find any that weren't issued by school resource officers.
And do you know, and I know this is a little bit out of your area, but if there's also been additional school district disciplinary action taken against students when they are issued a citation at school?
Good question, and I, probably my school resource officers know, but I actually don't know off the top of my head.
Thank you. And Mr. Gates, I think wanted to say something too.
Yes, thank you. I think that it was in 2018 that the state passed a bill that added electronic products, smoking products, vaping products to the state statute. Do you think that was also a factor in the schools calling about vaping? Now the state law have recently added those type of products to its prohibitions, along with tobacco and cigarettes.
That's a good question. Excuse me. Actually, I don't know. I wasn't aware that was a recent addition to the state side, so that very well could be as a sort of a new tool to officers on the street. Maybe that is one reason why you saw that change at about the same time, but I actually don't know the answer for sure.
I'm not sure if I have the right year. Maybe listening
Emily, yeah, you're correct. E-cigarettes were added into the section of state statute that has this penalties for youth use and possession in 2018, went into effect in January 2019. So yeah, that is new. And that would explain why they were able to cite for e-cigarettes when they hadn't been able to that point.
Interesting.
Mr. Hess, did you want to add some comments?
Why I originally started looking at this issue, I was contacted by the parent of a 15-year-old student from Shukiak High School. His son was in his 5th week in high school. He had no previous, disciplinary actions regarding tobacco or vaping. He was caught with vaping equipment. He was issued a citation and was suspended for 10 days. The parent was upset. He works 2 jobs. He had to take time off. He would have to take time off to go to court. It is a mandatory court appearance for the student. It's also a mandatory court appearance for the officer who issues the citation, because the officer acts as the prosecutor for these offenses. And the parent was confused because his son got a traffic ticket and he was in a classroom. And because traffic court is the low-level court here, the officers actually issue, it's a traffic ticket and for a smoking violation, tobacco violation. So I started looking at the code. I kind of looked at the history. In 2014, the Assembly passed an omnibus ordinance that removed a lot of offenses from Title VIII, our criminal code, and put them under our civil code. And the AM, which was written by the prosecutor at the time, said one of the purposes of the change was to eliminate those offenses from the penal code that provide for alternative enforcement approaches by either a minor offense prosecution or imposition of civil penalties. So the minor in possession offense was moved from the penal code to our civil code, which allowed for an appeal to the administrative hearing officer, but did not generate a court view record, was not a criminal offense. So under the state statute, it's a mandatory court appearance, and it generates a court view record for minor in possession of, which could potentially impact a student's ability to get a job, a scholarship. I mean, basically, we're criminalizing that offense. And of course, with the Tobacco 21 initiative, there are no similar penalties or consequences for 19 and 20-year-olds, because the state statute covers those under 19. Doesn't cover 19 and 20-year-olds. So when I'm looking at it, it just didn't seem fair that there's these serious consequences for 15 and 16-year-olds, but not for 19 and 20-year-olds.
Do you want, Mr. Hess, do you mind if Mr. Chief Dahl wants to say a couple comments about that? Or you could keep going and we could return to it. Do you have a preference?
I'll finish.
Okay.
So I contacted Dr. Bishop and Dr. Kirsten Johnson. Dr. Johnson and I have had several conversations, and one of my concerns when I looked at this, the parent was upset. They said, well, my son got this potentially $500 ticket, this record now in court view, and other students weren't receiving citations for similar offenses. So Dr. Johnson contacted several principals and confirmed to me that the district's enforcement policy is all over the board. It's inconsistent. Some schools, the administrator goes to the SRO, refers it to the SRO, and wants a citation, first offense. Some schools, it's the third offense. There are actually a couple of SROs that use their discretion and they will not issue citations. They say we don't do that any longer. So that was one of my concerns when I look at fairness and equity, is the enforcement policy, I believe, needs to be consistent across the district. And Dr. Johnson agreed with me, so we were wanting to have some conversations. I contacted Chief Dahl, and APD is on board with being part of that conversation. I'm sure this committee leadership might be interested. And one of the possibilities, when I talked to Dr. Johnson, they're very concerned because vaping is epidemic in the district. And they feel they need a tool in their toolbox, a higher level tool. And one of the things she and I talked about was potentially adding the offense back in our civil code. So it wouldn't be a mandatory court appearance, you wouldn't get a court view record, but there are some more serious consequences, and only have that civil offense applied to school district property. And they're comfortable with that. We haven't talked to Chief Dahl about that, but I did mention that possibility to him, and they want to be on board with that conversation. The Assembly, now I understand why APD, if you say, well, we don't want you issuing the state citation. I see both sides of this, but without something in the civil code, the district feels that they need that tool. My major concern is that it's not being applied consistently across the district, the enforcement policy. But to take away that tool when we don't have a replacement in the civil code, I think puts APD and the district in a difficult position. So the Assembly could possibly go down that road. You're still pretty much on board with with Tobacco 21 philosophy, but it's a realization that the district has some special needs and it's a special circumstance. I talked to a member of the school board. They're also open to a conversation about changing their policies. The assembly could potentially request that the legislature amend the statute so it doesn't apply to municipalities who have alternative civil penalties in their local codes. So but to do that without having that tool in the civil code for APD would probably be premature. So I think there's a lot of options, and I know APD and the district and my office, and I assume this committee and maybe even the health department would be interested in having those conversations. But I've committed to working with the district to make recommendations regarding consistent enforcement policy across the district. And the chief said that APD would like to be involved in the conversation.
I'd also like to mention that American Lung Association is working with the school district to create a more comprehensive policy to make sure everyone is following the same enforcement guidelines.
And one of the requirements that Dr. Johnson and I talked about was they are now searching or are looking at online courses that students who violate the policy would be required to take as far as the negative health impacts of tobacco and vaping. So that would be one of the requirements.
When you say the district policy, are you referring to SROs? Or are you referring to just?
It's actually the school board policies. So
Okay,
the school board
still
sets the policy.
Element, the SRO piece.
Right.
So we have
Our policies are totally separate from the school districts, and where we interface is that request from an administrator at a particular school to a particular SRO. And something that Mr. Hess and I talked about is every single one of those interactions, and frankly, every interaction that the police department has anywhere in the city is a one-on-one. An officer shows up, evaluates those circumstances, and then applies their discretion sort of against our policies and procedures and the law and their experience and all those things, and tries to make a decision. So, but that's where those two things sort of intersect, is that request from the school district administration to the individual SRO.
So there are several assembly members in the queue. Do you want to respond to what Mr. Hess said first, or do you?
If you don't mind,
guys
I have a couple of things that I think might be helpful.
Great. Is that okay with you all? And then we'll get to you. Okay. You want to do that now, or you want to wait till? Wait. Okay. Go ahead. And keep
Okay.
going.
Thank you, ma'am. Just a couple quick technical things that make this confusing sometimes, but where Mr. Hess was talking about traffic tickets. The citation form is called Uniform Summons and Complaint, and it does look like a traffic ticket, but it's it can serve to notify someone of a misdemeanor arrest. It can be a traffic ticket. It can be a ticket under state code for this type of offense. So it's just it can be confusing. You're like, oh, it's a traffic ticket. Well, it's not, but it does look like one. And so sort of the follow-on to that is we're talking about minor offenses, and we're also talking about minors who are being cited for offenses, and those are actually two totally separate things, which is super confusing. But a minor offense is a classification of offense in Alaska that is like this type of offense or traffic tickets. And the reason it gets classified that way is the way that it's adjudicated. And again, for a traffic ticket, which is a minor offense, the officer acts as a prosecutor as well, goes to court. We're all experienced, for the most part, or at least heard about traffic court. It's that style of setup. But minor offense is a classification of infractions in Alaska, which also include offenses committed by minors. So I just wanted to throw that out there in case that gets even more confusing. And then I do have some follow-up to some of the things Mr. Hess said, and I'm happy to roll into that or let assembly members go first, whatever the preference is.
I think go ahead.
Okay.
We have a bunch of folks in the queue that they can ask it.
Just a couple things. I totally agree with regards to vaping and that being a problem in the school district asking for help. Maintaining some kind of tool in an officer's toolbox to respond to that issue is very useful. I think having it be a civil offense from our perspective is great. We don't have any issues with that. Something Ms. LaFrance and I talked about pretty extensively was the ability to have options because circumstances can be different. And I tend to agree, like a financial penalty to a minor in a circumstance like this, or even an adult that's under 21, maybe is not the best tool, but some sort of education requirement where you attend a class or whatever. I think you could be very creative in the way that you address some of those things, but you didn't unfairly place a financial penalty on somebody who maybe wasn't able to do that, but you could still go towards that behavior change, which I think is what all of this is really about. And one thing that I think, again, just from the enforcement perspective, is anytime you take some kind of behavior and you say there's going to be no penalty for that behavior whatsoever, you're basically saying that behavior is okay. And I don't think any of us are really saying that people from 18 to 21 using vaping products is a good idea, since we've outlawed the sale of those products to those people. But if there's no penalty for their use, just from our perspective, it's like, okay, well, we're saying it's okay for you to have it and possess it and use it. And I don't really feel like that's the intent, but I just thought I'd throw that out there along with the suggestion and what Mr. Hess pointed out, that there are still alternatives available, I think, very creative solutions to still allow for some kind of tool for law enforcement in those circumstances, like on school district property where we feel like this behavior really isn't appropriate, but we can try to apply some sort of effect to it that will have a change. And again, some discussion was mentioned about state code, and I would certainly urge, whatever leverage you could have with the state, making state code consistent with municipal code or vice versa is always helpful from our perspective, because having things that are not consistent is difficult for us to enforce and keep track of. And then just finally, I have talked to Mr. Hess about the school district's policies here. We do want the school resource officer chain of command to be involved in that discussion. We agree. Consistent application across the school district will be very helpful from our perspective. So I think that was everything.
Great, thank you. Before we go to Mr. Dunbar, I just wanted to ask Ms. Neenan if she wanted to get in the queue. I think it'd be nice to hear you talk about the national policy of not enforcing against minors, and that actually was our intent. So I think there might be a disagreement here.
Madam Chair, before we go forward, I just wanted to point out that the school board policies are available, and in those policies, BP Board Policy 5131.62 tobacco, the fourth paragraph notes that the district shall provide positive alternatives to suspension, such as in-school suspension, educational programs, school and community service, and promotion of cessation resources. And then the other board policy, 3513.3, 1, 2, 3, 4, 5, 7, 8 paragraphs in or so, progressive consequences for students violating tobacco, vape, e-cigarette, intoxicating liquor, and illicit drug policy shall be outlined in the student handbook, which I think is consistent with what we're hearing from Mr. Hess, the chief. So, thank you, Madam Chair.
Thank you for your patience. Mr. Dunbar?
Thank you, Madam Chair. So I while we were here, I reached out to the state legislator. I don't know if anyone else has already done that, or if we want to do some kind of cooperative policy to. I think we should try to convince the state to change this law to be how it was, to be a civil offense rather than a criminal offense, and which is what we apparently did in 2017. You said 2014. Thank you. I just think it's horribly misguided to criminalize this act amongst children, basically. And I know that they're legally adults, but 19-year-olds are basically children. And I also think that, I'm surprised, I'm kind of surprised by this is not what I thought the SROs was doing. I guess I still have a lot to learn about. I thought SROs were there primarily to protect children, protect our students from, serious physical danger. I mean, for public safety, that kind of thing. And the idea that they're being used for what, for me, should be suspensions, expulsions, things that schools have been dealing with for a generation, that we're turning that into, we're criminalizing that, really disturbs me. And I'm not blaming you, Chief, or policies, or the policies of the APD. When we put police in a situation like this, I mean, that they're tools, that we've provided them these tools, and we should expect that. But to me, I I'm not sure if I even want to put the offense back in our policy, so much as I want to prevent. I want the school district to be using school district administrative tools to deal with these things, rather than any form of a criminal or police enforced code. But I think the first step is trying to convince. Well, it's going to take a little while. So the first step might be a change in school policy, a change in APD charging policy, and then trying to get the state to change their law. Because again, I think that criminalizing this behavior is horribly counterproductive.
Thank you, Mr. Dunbar. Ms. Salatell?
Thank you. So thanks to Ms. Prince for bringing the board policy. I do have some concerns at school district level. This has been where my legal practice has been in the school district. So consistency of enforcement of school policy, discipline policy in particular, has plagued the Anchorage School District for 15 years since I've been involved. So I think training is always good, but a lot of that discretion lands with the vice principal or principal at high school. And the enforcement of board policy versus the discipline policy, which goes out in the student handbook. We get too many policies and they're not consistent, and it's a lot of work for the school district to ensure that they are consistent. We start to run into problems because those policies have rights attended to them for the students, appeal rights, due process rights. Right now, I was just looking at the discipline policy for the school district. It defines tobacco. It also has a really clear drug and alcohol policy. The question of whether or not vaping falls in the drug and alcohol policy is a big question mark. I don't know. It's very unclear. So it sounds like we probably would need to work with our counterparts in the school district. They do have the drug and alcohol. It's a 10-day automatic suspension with 5-day, kind of a 5-day suspended sentence if you go through a diversion type program. So I think they could probably handle most of this, but it would need a lot of shepherding, I guess I would say. And then would have to be on the school board, unfortunately. It would then require probably a lot of individual school level education and a lot of updating of documents. Last time I was involved in doing a discipline policy with the school district, it took us about 3 years to get it from changed and completion. So,
do you want to wait or respond to that specifically?
Well, mostly some of the things that Mr. Dunbar mentioned, I just thought I would try to help shed some light on it. And if you guys get tired of hearing from me, just tell me to stop. So I wanted to make it clear, like, I'm not advocating for any particular policy, but I want to help make sure that we don't end up in conflict with either the intent of the assembly or the school district trying to cope with problems on campus. And so again, I'm happy to be part of the discussion, but I don't want anyone to think that I'm trying to push the policy decision making in a certain way. I just want to help point out pitfalls in whatever it is the body ultimately decides to do. So that being said, just with regards to the roles of school resource officers, this is something that actually I think is widely misunderstood. I think most people, especially if you watch like cable news or something, you assume that SROs are only in schools to defend, from, to defend schools from people spraying down playgrounds with gunfire, and that's their only purpose. And that is actually probably the least important thing they do. The number one reason that we put police officers in schools is for youth mentorship and outreach. That is why they're there. And they actually do a lot of that pretty much all day long. The second, kind of in order of priority, the second reason that they're there is to help handle problems that arise on campus, help the school district with that, and they do lots and lots of problem solving that doesn't result in like actual law enforcement action. But that is, at the end of the day, kind of a police officer's last tool is to use some sort of enforcement to deal with whatever the issue is. So there's lots that they do that really never gets sort of officially noticed because it's just a day-to-day working with the school district, resolving problems on campus. But then again, the higher profile things like, a student bringing a gun to campus or finding drugs on campus, those kinds of things that do require law enforcement intervention, they can step in and handle those things. And because they live all day long every day with the school on campus, with the school district, they're frankly a lot more adept at dealing with those than what we used to do, which is when I was new, you just got dispatched as a patrol officer to whatever school you happened to be working near, and then you had to kind of learn everything that was going on there and try to figure out some resolution. So they're actually a lot better at resolving those things than somebody that kind of walks into it cold. And of course, third and finally, they are actually physically present and capable of providing actual defense if there's some sort of serious physical threat to a school campus. So I just wanted to throw that out there. Mr. Dunbar is absolutely correct. I think that it does get misunderstood regularly, and so every chance I get to kind of talk about that, I do.
Okay. Is it okay if I put you in the queue? There's a bunch of members who have been waiting. Ms. LaFrance? You're good. Okay. Mr. Constant.
Thanks. About 10 minutes ago, Emily had suggested that there were some alternative opportunities for online kind of trainings or whatever that kids could go through as alternatives to sentencing. I'm hopeful we come up with a way to avoid court view records at all, period, full stop. And the second piece, Emily, I'm wondering if your organization or similar organizations might be able to provide an opportunity, kind of like community service, where these people, young people, could come to get hands-on, first-hand experience as opposed to internet-based activities. I know that might not be provided for currently under the law, but maybe it could be.
Through the chair, Mr. Constant, I'm going to kick that one to Shanice, who works through the State of Alaska Health Department Tobacco Prevention Program. Provides community-based grants throughout the state that work, some of which work directly with schools, and Shanice is the grantee through the Lung Association, funded by the State Health Department, to work directly with community partners. So I'm going to kick that to you, Shanice.
Sure. Currently, we only have online resources. So in-depth is what American Lung Association is trying to push into school districts, and that's just walking them through the trials and cycles of addiction so they can learn more about tobacco. But we currently don't have any in-person internship opportunities or any learning hands-on experience. But that can be something I can look into.
Thank you. Yeah, I just think that connecting kids with real people in the real world can have much better benefit than sitting in front of a computer, which we know kids do a lot. So thank you.
Amen. Ms. Newman, did you want to talk about the national policy and
sure,
sort of the reason behind what we did?
Yes, so wow, the whole nation took after Anchorage. Thank you for being leaders. This Tobacco 21, we knew this was taking off across the country. I think everybody was a little surprised that when Congress got it in the end of year spending package. Everybody was even more surprised when the FDA, after getting a hold of the transmitted signed legislation from Congress, said rather than taking their normal 8 or 9 months to write their regs and put this into place, they were making it effective immediately. So, when we look across the state of Alaska and across the whole nation, the policy decision about whether the age of sale for tobacco products should be 21 has been made. That's off the table. Now the question comes, what happens with how this is implemented throughout the country? I'm only concerned about Alaska and Anchorage. I will say, when going back to what's the theory behind taking away the penalties for use and possession, the idea there when you're changing the age of sale, that piece of the city code, which we did, was to make sure that the onus was on the vendor, not on the individual. In other states, we've seen places pass Tobacco 21 laws prior to the federal action, where they said, yes, we're going to raise the age of sale to 21, and what's the penalty going to be? Well, we're just going to have penalties on the kids and not on the vendors for selling. And obviously that doesn't make any sense. So the real focus around the penalty piece when you're looking at age of sale is on who's doing the selling. On the flip side of that, we also have a concern about criminalizing youth for being the victim of massive multi-billion-dollar international corporations marketing to them. So there's a whole other piece that's going on in that setting. And so we're sort of juggling that over here. And over here, we're juggling exactly what Chief Dahl said. If you say something's illegal, but there are no consequences, is it really, practically speaking, illegal? So I'm super interested in this conversation. Just to put it in context, we have a window of time here where the state is going to be looking, state legislature is going to be looking in this session, like right now. I was just in Juneau last week talking to legislators about this. There are members of the House and Senate who are both interested in updating the state statute. And so whatever information we can figure out here in Anchorage is really going to inform what the state is going to do. And so this idea of, yes, it would be really handy if the city law and the state law were the same, so there wasn't any confusion about what that is. This conversation is really informing what we can do, and I would give it a pretty good chance this session, like by whenever they end, April or May, actually being able to make that policy call in Juneau.
You want to add?
Yes, a question actually.
Okay, Mr. Rivera, thank you for your patience. And Suzanne wants to add.
Oh, I'm sorry, I don't want to jump the queue. I just want to get on the list.
Okay, you're on the list. Mr.
Okay.
Rivera.
All right, thank you, Madam Chair. So a few things. So first, I want to agree with a lot of the things that the chief said about SROs, and I think that's primarily a lot of the reason why the school district asked us to put SROs in a lot of other schools is because they have seen the value of them in the schools. Second, want to just note that I'm a bit puzzled that there's a big voice that's not in the room, and that's the school district. And we've been talking a lot about pushing things on the school district or changing school policy, but they're not here. So that's a bit puzzling to me. And then third is alignment. It appears that there is general alignment in the room on how to proceed, and now it appears that there's a timeliness factor here too. If the legislature is sort of looking at what we're going to do, then we better figure out what we're going to do. So I would like to hear from the co-chairs sort of the next steps to actually how we move forward on this.
Okay. Just to clarify, the school district was invited, correct, Carissa? So we'll have to reach back out and see why I'm not attending the meeting. I agree with you, it would be a more productive conversation from here. I just wanted to ask Chief Dahl a question quickly, which is why, especially given the federal landscape, and we know that on a federal level, well, anyway, I'll just ask more specifically. So why can't you, as the chief of police, use your discretion to enforce or not enforce state laws that are out of compliance with union laws? Why would you be forced to allow officers to give a state ticket that goes against the policy of who you work for? That's confusing to me.
So that's a good question, and we see this oftentimes in the frame of federal law enforcement and local law enforcement. Specifically, the one that tends to be the hottest is immigration, right? A lot of communities have big issues with that. So what I always tell anybody or anybody that will listen is if we think that we don't like a particular law, we should change the law. And we have a function to do that, and you all have the ability to do that at the local level. It is not good, in my opinion, not good public policy to ask your law enforcement agency to just ignore certain laws that we've decided today that we don't like. You want your law enforcement entity to uniformly enforce laws based on the totality of the circumstances at the individual event that they go to. And I think it's a very slippery slope to start saying, well, today we don't like this law, so we want you to ignore that one. But we do kind of like this one, so go ahead and do that, and then maybe that changes again. I think it is far better policy to actually change the laws to what we want them to be. And so I just tend to be very resistant anytime, and it comes up from time to time on various topics, not just this one, where somebody says, hey, we have an interest in not enforcing this law anymore, so we just want you to turn a blind eye to it. And I think we can probably imagine what kind of pathway that sets us on, and I just feel very uncomfortable with that. So what I tend to do is allow our officers to enforce the laws that we have on the books with their discretion, and then of course, somebody that disagrees with that particular application can always contest that in a court or with a hearing officer or wherever. But I'm very reluctant to issue a policy that says don't enforce a particular law. And there was another thought that I had that flew right off my head at the very end of that.
Well, it just seems that we're the muni, right? So yes, you have the ability to enforce state law, but I would suspect, and maybe I'm wrong, that your primary duty is to the muni. And so if that's the case, and there's a muni policy and muni law, and it conflicts with state law, why would you enforce state law over what the muni law is? I mean, basically you're choosing, right? They conflict, so you're choosing which to enforce. And the way I see it, you're choosing to enforce a law that conflicts with the muni law, and that doesn't make a lot of sense to me.
We actually do that all the time. And so it's not, I get from as a policy setter, from your perspective, that doesn't make sense. From a law enforcement, on the road, problem solver perspective, a law is not a policy tool, a law is a problem solving tool. And so an officer looks at the menu of laws that they have to apply to a situation, and they try to pick something that they think is going to have the most likelihood to resolve whatever issue they're faced with. So in this case, the issue typically is, I'm an SRO, a school administrator has reached out to me, hey, we have this problem with vaping on campus, and we don't want that to be the problem anymore, and so can you please help us resolve that? We know it's against the law, can you apply that law and try to help us change this behavior? So I guess I'm just trying to explain that from that officer's perspective, it's really not sort of the policy perspective that you have, and so that's why they make those independent decisions. And we really want them to do that. We want them to do that based on the laws that we give them, and not sort of on, again, like I said, sort of rehashing that same discussion of picking and choosing what laws to enforce. And so, and we do that in some cases that are not nearly that haven't raised this kind of controversy, because sometimes when they're either in conflict or not necessarily in conflict, but just different, the way that they're applied, both muni and state laws, they just tend to fit certain situations better, depending on what those are. So that's why in my discussions with Ms. LaFrance and my response to some of these things, I encouraged the policy or the law-making bodies to make changes to the code to reflect that. And I get that you guys have done that at the state, at the municipal level, but we're a complicated beast sometimes, and we live with a foot in both worlds, in the municipal legal realm, but also in the state legal realm. So
we're going to move on to Ms. Pineda. I guess I would just say that you're making the distinction of it's policy, but it's law, right? That's the muni law. Mm-hmm. So, Ms. Pineda?
So I just had one comment that I wanted to, that came up when Forrest was making his comment. So the 2014 change that occurred at the state level was a result of the Title IV working group, which started in 2010. And that was a big collaborative group. It's still going on. I think they're still trying to push some legislation through. Title IV is the alcohol law for the state. And the change came as a result of a partnership with and I was on the committee that did this with the prosecutor's office at the municipal level, the states, and a large group of partners. I mean, there's probably like 40 people on that committee, including the alcohol industry. And in the end, the piece of policy that everyone was willing to agree to was the change around, there's like 30 things we wanted to fix in that code, and they're still working on it almost 10 years later. But everyone was quickly able to gather around and change the criminal offense to a civil offense, and that was the result of that. So I think that it sounds like the timing's right. The legislature, many of them did this before, they're familiar with it, and there's a whole entire working group that effectively moved that change through. So I just wanted to suggest that I think that will be something that they'll be able to easily get on board with. And it was the community, the prevention community, and the prosecutor's office that really pushed for it, which was, I think, unusual for people to consider that change. I just wanted to shed that.
Great. Thank you, Ms. Benita. And Ms. LaFrance?
Thank you, Madam Chair. Just a quick follow-up to Ms. Neiman and the federal law. What exactly does the federal law say about minor in possession? What is the direction, and can APP just enforce a federal law?
It's not addressed in federal law. It's handled at the state and local levels.
So it directs the states. Well, what does it tell the states to do about minor in possession? Just so I'm clear.
I'm going to double check. Because I haven't asked this, I'm making some assumptions, which is dangerous when you're looking at federal legislation. But I don't think it addresses youth possession at all. I think that's handled just like the penalties that we have in our state for vendors selling. Those are state-based penalties. There are some penalties from that the FDA has, but they don't have the capacity to really handle the minor in possession issue. So I don't think that it's addressed. I'm going to double check that, but I think it's just at the state and local level where that's handled.
Thank you, Mr. Gates.
Yes, thank you. I was going to mention that I agree with what Chief Dawn said about choosing laws or choosing not to enforce law on the books. And our municipal attorney, Wynne Pearson, had an excellent email discussing that months ago. But I think as policymakers, we make policy by enacting code, that's where we'll comes in. And I think that the law enforcement, the only reason they do not enforce the law is if there's some direction from the Attorney General or the municipal attorney about the law is of questionable validity, something like that. And that's not the case here. And I think one thing that Chief Dawes said is the officers in the field, when they're choosing to enforce, they've got their list of laws in front of them, what applies to the situation. And right now, since we've appealed minor possession, that's not on the list. They just have the state statute. And so, I mean, my suggestion, and I think the direction to go is reenacting the minor possession violation in ordinance as civil penalty. And we do have, I guess, something comparable that I was looking at in our code for minors in possession of alcohol that has a violation, and that gives an option for the penalty to be reduced to, and this is a court offense though, but they can reduce that penalty to $50 if the person provides the court with proof that they completed an alcohol safety action program or a juvenile alcohol safety action program developed, designed, or improved by the state Department of Health and Social Services or a community diversion panel. And so I think this is maybe it sort of aligns with what they want to do at the school district, is have minors found vaping to do an online course or something. And this would work, I think, if we reenact our minors in possession, civil penalty, and what amount, I don't know, but that would be up to the body. And then as an option to instead do this a course or program and so forth, we only have an online person case. So this might work. I guess the issue is perhaps implementation and how long that will be needed if the state's going to change their laws by the end of May. Those are my thoughts, though, on the subject.
Thank you, Mr. Gates. Just so I understand, you're suggesting implementing a muni violation that's civil that comes with a different set of penalties so that officers on the ground could choose that over the state. But my question would be, why would they choose that? They have discretion. So here we are again in the same...
Actually, I have an answer to that. And
Great.
I think it's interesting. I hadn't thought about it the way Mr. Gates just put it, but it sort of made something dawn on me. by completely removing the municipal code as an option, like you basically defaulted responding officers to citing under the state code. So you basically pushed them over there by taking away a muni option. And I hadn't really looked at it that way before, but it was, I think, an interesting way to sort of frame that. I think that if there was a municipal option, we could certainly encourage people to use that. I mean, I think that that's a valid. I think it'll be interesting to see what the state does. If the state changes their code as well, then that would change the landscape again. But I hadn't thought of it that way, and so I think that was an interesting way to put it.
Okay, Mr. Constant?
Thank you. You know, just looking at all of this question, and we'll get some technical answers. The challenge, I think, is that we are finding and have found that this policy actually harms children. And so whatever we're doing right now is actually harming children in the name of helping them. And so I understand that the AD has the rules, we need to follow the law, we're sworn to it. We collectively need to come up with a solution to stop harming children.
Thank you, Mr. Constant. Mr. Dunbar?
Thank you. Yeah, a couple things. So, I mean, I understand what the chief is saying about the lack of the municipal option driving them to the state option. But if you look at the data, and I get this might be driven by vaping, but when they had the option to do both, in 2017 they did 15, 2018 they did 8, and then this is the year that it jumped. And you see in those same years, when they had the option to do both, they did 3 of the municipal one of the citation and 1 of the state citation. So, not, you know, even if you were to take all 3 of those and add them on, you'd have 4 citations, right, for this offense. And then it jumps to, let me do the math here, 74 total, 68 state just in 2019. So, I mean, I get that these are small numbers relative to the total number of citations your officers are writing citywide. But in terms of this policy specifically, there's been a massive jump in 2019. And I think it's disturbing that coincided with us specifically saying stop doing this thing. I mean, we said stop doing this thing, and it increased 1,000% in the number of citations written. So yeah. So that I think drives some of the frustration. On the state, in terms of how we actually communicate with the state, this might have been what your guys' plan was all along, but I know in the past we've done resolutions that emerged from a committee. So you can do a committee resolution passed by the assembly and then forwarded on to the state. Now we communicate all our resolutions to the state. I think that I would suggest as an effective option rather than going to administration and saying, could your lobbyists please talk to people about this? I think it behooves the assembly to speak directly to the legislature, and to me that seems like the best way to do that collectively. I also think it's a great topic for the legislative committee if we can find the time for us to talk directly with our legislators in February and March. And Ms. Neenan, were you going to divulge which legislators are thinking about putting forward a bill?
I know that there's several people considering it in the Senate, but in the House, Gary Knopf actually introduced a state T21 bill at the end of last regular session, and I know that he had just requested Ledge Legal to update his bill to conform with the federal law.
But the federal law is silent to minor in possession.
The federal law is silent to minor in possession. The federal law took some things off the table, like the military exemption, for instance. There's no military exemption in the federal law. So there were some things that needed to happen in Gary Knopf's bill in order to make it match, because he originally had
I think we should we only have a few more minutes. So he's presumably supportive, I think is the...
Well, does this legislation include a reduction in this particular offense, or is it silent right now to this statement, to this criminal statute?
He didn't make a change, because all he did was replace 19 with 21, which was where you guys started out with the very first version.
So we will need to ask him to revise his bill as it goes forward.
Yeah, and I think he would be open to that. Great.
And you wanted to say
I just wanted to one more wrinkle. When you're talking about your tobacco, drug policy, alcohol policy, all of which have differences, when you're looking at an electronic smoking device, you can't always tell what's in it. So something to consider as this conversation goes forward is somebody looking at the device doesn't know whether it has marijuana in it or tobacco. There's a whole other issue with the state has not enacted changes to penalties for youth use of marijuana. So now those are being dealt with through federal law. So there's another complicating factor. I just wanted to flag that for further discussion.
Can it be quick? Sorry, I know you haven't spoken much or at all during this meeting.
Totally quick one. Has there been anything that has arisen around other things being in there as well?
Yes,
I mean,
even here in Anchorage, they
Meaning
have
that all the
spice
drug conversations
in
we were having
drugs.
before, is they're beginning to have, like, it could have all kinds of other more serious things in there? Okay.
So we only have a couple minutes left. It seems like the next steps are maybe to consider a muni, civil offense, to work with our state partners to try to change the state law. Yeah, that seems like what we have at this stage. So I suspect that Emily, maybe Chief Dahl, Mr. Hess, others, hopefully someone from the ASD.
I was going to throw in working with ASD
Yeah,
to maybe make a uniform enforcement policy would
Right.
also be something that's useful.
Is there someone that,
I've been talking to Dr. Kirsten Johnson,
Okay.
is who the superintendent asked me to look at.
and so is there's an ongoing sort of committee or group, or is it more just you've been working with her directly, Daryl?
Just directly with her.
So I don't know who wants to take the lead, but if someone could take the lead on maybe organizing a more organized group, and we could be involved in that too, or not, you could come up with a recommendation, bring it back to us, however you want to do it, and in the meantime, we could start working on on a resolution that we bring forward to our body that aligns with the goals that you all are trying to meet as well. Does that sound good? And maybe we reconvene. Yeah, Mr. Dunbar?
Can I make a suggestion?
Sure.
Madam Chair? We've done in the past in assemblies, taking a vote of the voting members of the assembly to just support a resolution in concept, so that we don't have to wait until the next health policy meeting to actually have a resolution from the committee go out to the full assembly.
Great idea.
Can we take a vote maybe today to support such a resolution, and then the actual resolution will be placed on maybe the 11th or the 25th? I mean, hopefully the 11th. I mean, it's a little bit soon, but because of the short legislative session, we probably want to get it going pretty quickly.
Yeah. Does anybody have any opposition to that or need any further clarification on what the resolution would entail?
Am I actually a voting member on this?
I think you are. I think we're somewhat on the same page about the two courses of action and what we want to share with our state partners. Mr. Constant, are you okay with that? I'll check with them. Okay.
Yes.
Oh, great.
Okay, good. You have a quorum.
Thank you. Yeah, do we have a quorum?
Yeah, we have 6
I just
members.
want to say thanks to all of you. If Chief Dahl, Ms. Pineda, Ms. Thiemann, others, if all of you weren't here, we wouldn't be figuring this out. So it's really kind of a team effort, and it was a really great conversation. And anything you want to add, Ms. LaFrance?
Well, I wanted to nominate Mr. Hess to chair the subcommittee. If you would, because it seems like you're already involved with
I will
everyone.
organize a meeting.
And I would echo my thanks to everyone.
And I'll bring snacks.
participating in the conversation.